So coming to the glucose tolerance test, it means the ability of the body to utilize glucose in the blood circulation. So glucose tolerance test is the measurement of plasma glucose before or after a specific amount of glucose is given orally, or it should provide a standard method to evaluate the individuals and for specific normal values and specific disease condition. And this test is mainly used to assist in the diagnosis of diabetes mellitus, and it is also used in the patients for the evaluation of hypoglycemia. So hypoglycemia is nothing but the low blood sugar level. Hyperglycemia is the high blood glucose level. And diabetes mellitus is a disorder of fuel metabolism, and there are two types of diabetes mellitus, type 1 and type 2. And type 1 it is called as insulin dependent. So it depends upon the insulin level. And type 2 diabetes, it depends upon the non-insulin dependent diabetes, and it is also referred to as insulin resistant. So insulin resistant. So both are characterized by the hyperglycemia, and it is having the inability to properly metabolize the glucose level. So to assess the insulin performance, so the medication physicians use the oral glucose tolerance test. So coming to the indications of glucose tolerance test. So the glucose tolerance test may be used for the following conditions. The patients who have the family history of diabetes and who are massively obese, and it is having the recurrent infections, or if the patient having the delayed wound healing, especially in the lower legs or feet, and the women who have the histories of stillbirths, premature births, or large babies, and patients who have glycosuria, that is the glucose is elevated in the urine, or hyperglycemia during pregnancy, or myocardial infarction, or maybe undergo surgery or stress condition. So what are the factors that is interfere with glucose level maintaining? It is this first one, smoking, and another one is stress, and another one is exercise that can affect the glucose levels, and fasting or reduced caloric intake before the GT test can cause the glucose intolerance, and main usage of drugs. So for preparation, the patient is instructed not to restrict carbohydrate intake in the days or week before the test, and this test should not be done during any illness such as fever or headache or anything. And usually the OGTT is nothing but oral glucose tolerance test, is performed in the morning as empty stomach. So it can exhibit the diurnal rhythm with a significant increase in the afternoon. So the patient is instructed to fast for 8 to 12 hours prior to the test. So the patient has to finish off the dinner by 7:30, and it has to be fasted by the empty stomach, 8 to 12 hours fasting. And procedure, 0 time blood sample is drawn, that is the empty stomach, and the patient is orally given the 75 gram of glucose in 300 ml of water and drink within the 5-minute time frame, and blood is drawn every 30 minutes for 2 hours. So if the person is having the oral glucose by the time of 7, so he or she is allowed to take a blood test by 7:30 and 8:30 for 2 hours. So the intervals and the number of samples vary according to the purpose of the test. For simple diabetes, only the 0th hour and 2 hours sample is necessary, and for this critical blood test, every 30 minutes the blood is drawn. So materials, it is glucose meter is required with pen prick with lancet and glucose strips and digital glucose meter. So these are the having materials required. And methods of measurement. We shall having the droplet of blood from finger, and the partner can prepare glucose meter by placing a strip in the meter, and in the LCD it appears the value, and an infrared light scans the strip and matter of 5 to 6 seconds, and furtherly the digital value is displayed in the screen where it is maintained as mg per deciliter. So record the data, and it should be clarified with the results. So 30, 60, 90 minutes the graph should be drawn for the interpretation of the result.